So for lower risk patients, we've had relatively limited options for a long time. We have erythropoietin stimulating agents really being our main therapy to lead to hematologic improvement, transfusion independence, although now we have approvals of luspatercept, both second line and more recently frontline, and hoping for the near-term approval of imetelstat, potentially sometime in 2024. And so data have suggested for a while that potentially intervening earlier before patients are heavily transfusion dependent may matter. But what we wanted to look at is the impact of response and the impact of response based on the line of therapy predictive of outcomes. So it's a pretty large cohort, it's over 600 patients of lower risk MDS, and we really parsed the groups based on frontline versus second line therapy and whether or not they responded or not, really just in the setting of ESA therapy. And I think not necessarily surprising, but the data are pretty robust in that patients who responded with frontline therapy by far had the best improved overall survival. Median survival was pushing towards 10 years. Patients with second line that did receive response had improved survival, but actually was worse than if it was as frontline. And then patients that did not have response actually had outcomes that were not great even for lower risk MDS patients. I think it'll be interesting to look at this. There's some data that Dr. Santini has presented before suggesting similar findings potentially with luspatercept. And if we look at the frontline command study, the median duration of response is far longer with luspatercept as frontline than what we saw as second line. So I do think potentially intervening earlier when patients may have symptomatic anemia but not yet transfusion dependent may give us not only a highest chance to have response, potentially give us the best durability and ultimately the most improved overall survival. And I think now that we have lots of agents, I think thinking about this becomes actually a much more important topic to consider.